On the medical feed this morning, the Unwearable Collection, an award-winning fashion design collection, is raising awareness for generalized pustular psoriasis, a chronic skin disease consisting of painful blisters that can erupt over your body out of nowhere, often requiring urgent hospitalization. Joining us this morning with more insight is Clinical Professor of Dermatology at Yale University School of Medicine, Dr. Bruce Strober, and a person living with the disease, Brandon. Good morning to you both.
Good morning.
Good morning.
So Dr. Strober, tell us why it's so important to get diagnosed for GPP and why is it often misdiagnosed?
Well, GPP is a chronic condition that is often lifelong, and it's associated with a lot of symptoms that make a person feel unwell. First and foremost, the flares of the red rash and the pustules, as you described, are painful and tender, and people often feel fatigue, unwell, fever, chills, arthritis. And most importantly, people who aren't treated might actually be hospitalized, and there is some mortality associated with untreated GPP. It's hard to diagnose because of its rarity. Most doctors in their career won't see a case. Dermatologists will, but often only maybe one case a year. So a person who walks into the office with symptoms and signs looking like GPP still has to undergo certain types of tests, like a skin biopsy and blood tests, to really nail down the diagnosis. It might take a few visits.
Looking at the demographic of those living with GPP, are we seeing more men or women living with it, and what age are typically most people diagnosed at?
Well, it's really an equal opportunity disease, and probably a little more women than men, but I see both sexes affected by this condition, and it's pretty much in all age groups, but primarily, most commonly in middle-aged adults in their 40s and 50s.
Brandon, can you tell us a bit more about when you were diagnosed and how GPP impacted your life?
For me, it was a very rare case. I was diagnosed with GPP when I was just a baby. I had my first major flare-up when I was 11 months old, and I was taken straight to the hospital. From there, I spent months in the hospital with dozens of doctors all coming through and running tests to try to figure out what was going on with me before I finally got my GPP diagnosis.
And Brandon, how does the Unwearable Collection capture your experience of living with GPP?
The Unwearable Collection is just fantastic. There's 5 different pieces to it, and each one encapsulates a different part of living with GPP, from the sudden intensity of the flare-ups to the isolation you can feel from having it, to the pain and the restrictions that you can have because of the GPP.
All right, Dr. Strober, Brandon, where can our viewers go to learn more about GPP and the Unwearable Collection?
Well, a good website is gppandme.com, where you can learn all about the disease, the patients and their experiences with it, and a link to the unwearablecollection.com.
All right, thanks again to both of you for being with us.
You're welcome.
Thanks for having us.